All right, many Nigerians are still trying to recover from the extension of the lockdown, especially those who reside in Lagos, Ogun, and the FCT, and some other states in the country. My name is Kunle Son, and this is Serious Matters on ONIF TV. Let's look at updates on COVID-19 in Nigeria and probably across the globe. The Minister for Health has announced that 9,000 persons have met with confirmed cases of coronavirus since the pandemic broke out in the country. And so that means about 9,000 cases. The country has made significant cases. At the moment, the country has recorded 343 confirmed cases of the disease since it came into the country on the 28th of February 2020, while 91 patients have recovered. 10 deaths were recorded at the last count. That means, but then when we're doing the next update, I know that there have been other fatalities, maybe a number of them who somebody just came in from the United States and died. The good thing is that the Ministry of Health has been able to trace 9,000 contacts. 9,000 contacts have been traced, which is of course good enough. Of course, I don't know. We don't know how many more people had contact with these people, and that's is like harboring danger for any other person. And if there is, you remember they said there are some who are asymptomatic, where you say that they do not show the sign even though they are infected. Those ones are more dangerous, and those are the ones that were recorded in the UK amongst the number of persons who signified interest to be evacuated back to Nigeria. So good to hear that. Good to hear that. We still on COVID-19. Still there are issues of hunger. In Lagos, there was a drama. It was a drama, so to speak. When hungry Lagosians mobbed a bus loaded with bread. I don't know, somebody doing his own business, and a bus loaded with bread was being mobbed by people who are hungry. People are hungry, and it's already showing all over the place. In Lagos alone, we had hoodlums get onto the streets. I mean, in the last couple of days, we've had arrests being made by the police, and so we've had that happening. We've had that happening. In those places. So we see people not really finding it funny staying at home. Probably because of the financial situation, and a lot of people which of course the president made mention of, that he acknowledged the fact that a lot of people make their living from, or earn their living from, daily income, daily businesses. So we should that's the issue. EU, that's the European Union, has given Nigeria a grant of 50 million euro to fight coronavirus. Corporate medical doctor serving at Ondo military barrack test positive. Still, Kaduna Express Road on lockdown, where Commissioner assures Lagos residents of safety after attacks by thugs. Doctors say coronavirus can spread through fats. Well, that's that's another side entirely, but let's look at it. Let's look at it closely. The deadly coronavirus could be spreading through fats, according to doctors, but fats are unlikely to transmit the virus, provided pants are worn. Entire. This is becoming serious, So you cover nose, you cover everything. If somebody who is infected, fats. It's been said that the virus could be transmitted or could be spread, provided except the fellow is wearing pants. Well, I trust a lot of people are wearing pants. Tests carried out have shown that the virus was present in the feces of more than half of the patients with COVID-19. They said more research needed to be done to rule out passing the disease on to people through emitting bodily gases, and that's just still that. Well, let's not panic. Even with all this research and outcomes, let's not panic. Let's just be very, very careful. Let's face what we are being told to do. Let's be careful totally. Well, like I said earlier on, we already have 343 cases. We have about 91 discharged already. More are still being discharged. And so we have about 10 fatalities already who have died. So, but then maybe before the end of the day, or by tomorrow, we would get you more details on the updates of coronavirus. Thank you for watching. Bye bye.